Welcome back to Talk of Alabama. We've got Dr. Wayne McGough here with us now, Dr. Wayne McGough Jr. He joins us from Andrews Sports Medicine and Orthopedic Center. Good morning.
Good morning.
So we're discussing injuries in young athletes.
Correct.
And are they on the rise right now?
Yeah, well, first off, thanks for having us here, Ebony. We appreciate it. At the American Sports Medicine Institute, which is the research arm of the program that I'm a part of at Andrews Sports Medicine, we've been studying this for several years now. And what we've seen over the past 10 or 15 years is there's been probably about a 5 to 7-fold increase in the number of sports injuries in these young athletes. And in high school age athletes alone, there's about 2 million injuries per year that are sports related, which leads to about 500,000 doctor visits. So it's a pretty significant problem.
Why do you think it spiked?
Well, I think it's multifactorial. I think for one, we've got more kids participating in sports now than we ever have. So probably around 35 million kids are participating in sports each year, aged 5 to 18. So if you have more participants, you're going to have obviously a higher rate of injuries. But there's other issues as well. These kids have immature bones typically, and so those immature bones are prone to be injured in ways that adult athletes don't have problems. In addition to that, these kids probably don't have access to the proper training sometimes or conditioning that professional athletes have. But we think probably the most important reason is that there's been a push towards early specialization in sports, where these athletes decide basically they're going to play one sport and then play that sport all year long. And years ago, probably athletes would play multiple sports through the years, and so they had a built-in rest period basically, and they sort of cross-trained throughout the year, and that was protective. But now they're deciding to play one sport all year long, and the body's seeing the same repetitive stress over and over, and that contributes to injuries.
So what is the best advice that parents can follow if they have a young child who's interested in sports?
Sure. Well, I think the most important thing that we've seen is that there has to be a period of rest every year. And so we recommend at the bare minimum, there needs to be probably a 2 to 3 month period where they're resting from any given specific sport. And if they're competitive throwers like pitchers, we really want them to rest for about 4 months each year. And we believe that'll help contribute to improvement in their outcomes.
Some parents may be hearing this, they're like, well, there's no way that little Johnny can take 3 months off from practicing or training.
Yeah, we hear that all the time. And I think it's tough. And I think that the idea is the kids feel like, well, if I play all year long, then that's going to eventually help me get to the next level. But in reality, what happens is they get hurt and they actually shorten their careers probably. And so, I think it's got to be a team effort where the parents and the coaches both get involved and put the kids' best interests first, and that would be just to encourage them to rest when they can and to take a few months off each year.
Now, if they do take that 3 months rest, is that a rest from all sports, or if they play football, could they play basketball? Yeah,
no, that's perfectly fine. What we don't want is for kids to play the same sport all year long, so their body's seeing the same exact stress all year long. We want them to rest from probably 2 to 4 months from any one given sport, basically.
So they can still be getting in shape.
Absolutely, yeah. Getting in shape is important, and getting in shape and the cross-training effect from playing multiple sports probably has a protective benefit against injury. We just don't want them to play the same sport all year long.
So what if they only have an interest in that one sport? What do you do then?
Well, I think, again, it's tough. You have to take a team approach, encourage these kids to look kind of outside the box and find something that's not sports related they could do for a few months a year, or play a different sport like you suggested.
Okay. So if a parent has a child with an overuse injury, what do they need to do?
Well, we kind of like to follow the RICE protocol, which basically means to rest for a period of time, to use ice, compression, elevation. And so the first thing is you don't want to ignore these injuries. There's no reason why any sort of adolescent athlete should be playing through pain. I mean, pain is your body's warning sign that there's trouble ahead. So they should rest for an appropriate period of time, probably at least a week or two. And if their symptoms don't improve, they need to seek medical care. And that's kind of where Andrews Sports Medicine Orthopedic Center can get involved. We have multiple orthopedic sports medicine providers and non-operative sports medicine providers that can help evaluate these kids in a timely fashion and help provide treatment.
All right, so where are you guys located?
So you can find us on the internet, www.andrewscenters.com. We have multiple locations around the Birmingham area. Currently we have a location at St. Vincent's downtown, which is kind of home base for us. But our office can be contacted at 205-939-3699.
andrewscenters.com, and encourage your children, if they have something that's kind of bothering them, to let people know so they can go get help.
Sure, don't ignore it.
All right.
All right.
Thank you so much.
Thank you.
Okay, there's still more to come on Talk of Alabama, including